Heat-related deaths have been increasing globally due to climate change, with more frequent and intense heat waves affecting large populations. Understanding the causes, risk factors, and prevention strategies is crucial for reducing mortality rates associated with extreme heat. Causes of heat-related deaths. 1. Heatstroke, the most severe form of heat illness. Heatstroke occurs when the body's temperature regulation system fails, leading to body temperatures above 100 for F4C. Without immediate treatment, heatstroke can cause damage to vital organs and death. 2. Heat exhaustion, a milder form of heat-related illness. Heat exhaustion can progress to heatstroke if not addressed. Symptoms include heavy sweating, weakness, dizziness, nausea, and fainting. 3. Dehydration and electrolyte imbalance. High temperatures increase the risk of dehydration, which can lead to severe complications like kidney failure, seizures, and death if not treated promptly. 4. Compromised health conditions. People with pre-existing health conditions, such as heart disease, respiratory illnesses, or diabetes, are more vulnerable to the effects of extreme heat. Vulnerable populations. Elderly, older adults often have a reduced ability to regulate body temperature and may be less aware of the need to stay cool and hydrated. Infants and children. Young children have less developed temperature regulation systems and are more susceptible to dehydration. People with chronic conditions, those with cardiovascular, respiratory, or metabolic conditions are at higher risk. Outdoor workers, individuals working in construction, agriculture, or other outdoor settings face increased exposure to extreme heat. Low-income and homeless populations. Limited access to air conditioning and cooling centers puts these groups at greater risk. Global impact and statistics. Rising heat waves. Heat waves have become more frequent and severe, leading to spikes in heat-related deaths. For example, the 2003 European heat wave caused an estimated 70,000 deaths, while recent heat waves in the US, India, and Australia have also led to significant mortality. Urban heat island effect. Cities tend to be hotter than rural areas due to the concentration of buildings, roads, and other infrastructure that absorbs and retains heat. This effect exacerbates the risk of heat-related deaths in urban populations. Prevention strategies. 1. Public health interventions. Governments and public health organizations often issue heat advisories, open cooling centers, and distribute water during heat waves. 2. Community awareness. Educating the public about the dangers of heat, recognizing symptoms of heat-related illnesses, and knowing when and how to seek help are critical steps. 3. Improved infrastructure. Planting trees, creating green spaces, and designing buildings with heat-resistant materials can help mitigate the urban heat island effect. 4. Personal precautions. Staying hydrated, avoiding direct sunlight during peak hours, wearing lightweight and light-colored clothing, and using fans or air conditioning are basic preventive measures. Long-term solutions. Addressing climate change is fundamental to reducing the frequency and severity of heat waves. International efforts to reduce greenhouse gas emissions, transition to renewable energy, and enhance global cooperation on climate issues are crucial steps toward mitigating the health impacts of extreme heat.